Hello, I'm Dr. Patrick Hwu, CEO of Moffitt Cancer Center. We're here in Chicago at ASCO 2024 with Dr. Brian Gonzalez, heads our diversity program in our clinical cancer center. So thank you, Brian, for being here.
Happy to be here.
Yeah, right, so you're doing a presentation on hormone replacement, or hormone inhibition, and quality of life.
Yes.
So why don't you talk to us about that?
So many men with advanced prostate cancer are treated with androgen deprivation therapy, or ADT, and that has there are clinical reasons for why to do that. It's important for many patients, but the downsides are there are lots of side effects or toxicities that it causes. Some of those are loss of muscle mass, which can be impactful, right? Because suddenly now people are at greater risk for falls, or they're just more frail because of that. Some of that is hormonal problems. So there may be men who weren't really expecting to go through hot flashes when they were older, and suddenly now they are because of this life-saving drug. And there are others as well. And so what we're here to present is about behavioral therapy, so non-drug therapies that can be helpful for addressing some of those same issues that ADT causes for men with prostate cancer, and how to overcome them.
Yeah, so loss of muscle mass, a very important thing is, and prostate cancer is a disease of older men, and so frailty is a problem. Falls, incredibly big part of morbidity, mortality. So are you studying using exercise along with deprivation therapy to try to combat that loss of muscle mass?
That's exactly right. There are lots of studies out there in the literature showing that exercise, specifically resistance training, the kind of exercise where you're pushing or pulling on something, can be really impactful. So the guidelines recommend doing at least 2 or 3 sessions of strength training a week, in addition to cardiovascular exercise that is helpful for different reasons as well. And so that's going to be really impactful for not only that muscle loss, but also for other areas of your quality of life. There's also cognitive behavioral therapies. So the kind of therapies where you're trying to identify not ways to solve the problem necessarily, but solutions to help a patient cope with the changes in their lifestyle, changes in their functional abilities, and that kind of coping strategies that they can help come up with, or ways to mitigate the impacts on their life, can be really helpful for their own quality of life, the way they feel, and then sometimes even the way that they're functioning as well.
Thanks so much, Dr. Gonzalez, for being here with us today. Dr. Brian Gonzalez, expert on androgen deprivation therapy as well as diversity at Moffitt Cancer Center.
Thanks again for the opportunity.